Start பண்ணிக்கலாம் சார்.
देवीं वाचमजनयन्त देवाः विश्वरूपाः पशवो वदन्ति सा नो मन्द्रेशमूर्जन्दुः नाधेनुर्वागस्मानुपसुष्टुतैतु यो नः पिता जनिता यो धाता धामानि वेद भुवनानि विश्व यो देवानान्नामघायेक एव तं सम्प्रश्न्यं भुवनायन्त्यन्या. Good evening, everybody. I derive immense pleasure in welcoming the chief guest, Dr.S.Swaminathan, the head of the department of Ayurveda in Sri Jayendra Saraswati Ayurveda College for this joyous occasion. It is the fourth lecture in the webinar series organized by the esteemed Shastra deemed it to be university. I welcome the chief guest on behalf of the management of Shastra University, and on behalf of the Department of Oriental Studies, and on behalf of you, the beloved students. Dr.S.Swaminathan is such an expert. He has written his name indelibly in the scroll of fame by his towering personality and achievements. He is such an expert in Ayurveda that by observing the gait of an individual, he can tell whether his body is Kapha Shariram, Pitta Shariram, or Vata Shariram. And today, the 27th Pasuram of Tirupavai is being chanted, recited in all Vishnu temples, Kudarivalli, for conquering all enemies, both external and internal. Sri Vedanta Desika has written one sloka, one stotram known as Sri Haigriva Stotram. It is his masterpiece. It contains all concepts of several subjects, including Ayurveda. And it is recited for curing nervous problems. Why there is a connection between Haigriva Stotram and nerves, nobody knows it. But in Shastra University, one scholar is doing research on Sri Haigriva Stotram, and he has arrived at the result that if you take the opening stanza of Sri Haigriva Stotram, that is Jnananandamayam, and if you apply Vedic numerical code, it contains the number 106, the term is 106. Whereas in Charaka Samhita, Charaka has given 107 vulnerable points of the body, Marmasthanani. Jnananandamayam devam nirmala sphatika kritim adharam sarva vidyanam hayagrivam upasmahe. So there is a concept of Katapaya Sankhya or Vedic numerical code right from Vedic ages, and if it is applied to this particular shloka, you get the total of 106, whereas Charaka's Marmasthanani is 107. And deliberately, willingly, wantonly, purposely, Vedanta Desika has omitted one number. May the neighboring, and he invokes Lord Hayagriva, Hayavadana Hesha Halahalaha, Hayavadana Hesha Halahalaha, Ashwanam Hesha. So the Halahala Karaha is the neighing sound of horse. That is called the Halahala Shabda. So may the inhalation sound generated by the Lord Hayagriva remove, dispel the darkness, both the inner and outer darkness. Okay. So we have to conquer all the enemies, both the internal and external. That is for Kudarivalli. Kudarivalli. Okay. And Lord Chesterton says, in one of his essays, the incredible thing about miracles is that sometimes they do happen. Similarly, even this small booklet, this stotra is a small booklet containing only 32 stotras. It contains all subjects under the sun. Vedanta Deshika has written this as a treatise for several subjects under the sun. I'll give one by one. For example, halahalaha, kayavadana hesha halahalaha. Halahalaha means if you say only it is the neighing sound of horse. But Dr.S. Ramananda Tatacharya, in his commentary on Shatadushani, has given a different meaning using Vyakarana Shastram of Panini, hallucha, ahallucha. Hall means we use the hal pratyahara of Panini, Hayavarate, Landing Yamanganam, Jabangi, Gadadashi, Jabakadashi, Kappa, Chatata, Chatata, Kapai, Shashasar, Hal. So all these consonants are denoted by the symbol hal. Ahal means other letters other than other letters. That is ach. Up to this. So this is called ahal. So hallucha, ahallucha. So halahalaha. So this beautiful meaning is given in the commentary of Shatadushani by Dr.S. Ramananda Tatacharya, a great erudite scholar of Sanskrit, and it is often quoted by our Srimad Andavan, Srimad Andavan, the previous pontiff. And usually if you see the Podikai news or DD news, first of all, they will give the news in summary for a few lines. After they will elaborate. Similarly, Sri Vedanta Deshika has given the opening shloka for Ayurveda to cure nervous problems, mentioning the 106 vulnerable points of the body, and the remaining 32 slokas, omitting the Palashruti. If you take the first letters of all the slokas and find the total, again you will get 106. That is a miracle. That is why I said the incredible thing about miracles is that sometimes they do happen. And not only that, Vedanta Deshika has given the divisions, various divisions of vulnerable points as per Charaka. That is Mamsa Marmani, that is muscle Marma points, Sandhi Marmani, joy in Marma points, Asthi Marmani, bone Marma points, Snayu Marmani, ligament Marma points, and Sira Marmani, blood vessel Marma points. So if you take the opening shloka, take the second, Uttarardham, Adharam, Sarva Vidyanam, Hayagrivam, Agrivam. So you start from A meaning since, Grivam, Griva means neck, Agriva means up to neck. Up to neck, you find the total using that Vedic numerical code or Katapaya code, you will get the same total as Charaka mentions in his Charaka Samhita. So not only that, another division based on sites is also given by Sri Vedanta Deshika in his poem, Udara Marmani, thorax and abdomen, and Prishtha, Shakha, and Urga Jatru, neck and head. So all these 4 divisions have been mentioned beautifully and wondrously in Hayagriva Sastram, and on the basis of properties he has mentioned Saumya Marmani, Kapha, and Vayavya Marmani according to Vata, and Agneya Marmani according to Pitta, and Saumya Greya, and Kapha and Pitta. Agno Samidha Chisapta Tantaha Atathivan Mantramayam Shariram Akhandazareir Havisham Pradanihi Apyahayanam Vyoma Zadam Vidhatse. If you take that, that will denote you the code for Vata, that is Agneya, Pitta, Agneya Marmani. So these Marma points, Bindu, a dot, a secret dot or mystic points, he mentions in his shloka, 16th shloka of Hayagriva Sastram, Swamin Bhavadhyana Sudhabhishekat Bahanti Dhanyaha Pulakanubandham Te Kwapi Nirudhamulam Angeshvivanandatvankurantam. So touching the Marmasthanam changes the whole body's biochemistry and can unfold radical alchemical change in one's makeup. It is a consequence of a firm-rooted happiness, real bliss in some unidentifiable spot which has manifested itself on every limb. So they derive a glee thereby contemplating on you, O Lord Hayagriva, unceasingly, incessantly, without a break and without an interruption. And not only that, it can be treated as, it can be considered as a treatise on Ayurveda. It is a treatise on astrology, Hayagriva Sutra, because he mentions all 9 planets and the properties in several shlokas. You have to find it. Mando yatam virinchas Shanishara. Brihaspatim vartayase yatastvam. Brihaspati is Lord Jupiter. Chandrodaya vardhamam, moon, Jupiter, moon. Sharadghane chandram ivaspurantam chandra. So he mentions all planets. Prabodha sindhor arunai prakashaihi. He mentions Buddha, the planet Buddha. And it can be treated as a treatise on gemology. Hayagriva Sostram. Pravala sanghata mibodhahanda. Pravala is coral. Vibrat bhinna sphatika ruchire punda sphatikam. Shuddha sphatika mani bhubhrit pratibhatam. And it the Shastra. Atasthivan mantramayam shariram. He mentions it in his Yunana with shlokas. Atasthivan mantramayam shariram. Dakshinyaramya girishasya murti. He gives, he indicates Dakshinamurti mantram in that particular shloka. And not only that, Saraswatim samshitaka madhenum. In that shloka, you can find Saraswati mantram. Brihaspatim vartayase yatastvam. You can find the Brihaspati mantra recited as per Ayurveda in that particular shloka. And again, wondrously, you can draw a paint, you can draw a picture of Lord Hayagriva using the 32 dots of 32 shlokas. He gives the directions. Prachi Sandhya, go by east. Prachi Sandhya, Kachitantar Nishaya. Go west, Swamin Praticha, Hridayera Dhanya. Go south, Dakshinyaramya, Girishasya Murtihi. Go by north, Vamam Karam Dakshinamashit, Vamam Karam Dakshinamashitaram. Again go, come to east. Pragnirmitanam Tapasambika Vipakaha. So you have to study deeply. So if one delves into the realm of Sri Hayagriva Stotram, you can find all subject under the sun. He quotes marine engineering. Nachapi tirtheshu kritavatirtha. So if you read Hayagriva Stotram, you have gone to all tirthas in India. Nachapi tirtheshu kritavatarah mandakini mandayitum kshamante. Mandakini, he mentions Mandakini. Vela mudara mipadugdha sindho. He goes to the Milky Ocean. Saraswatim samshitaka madherum. So we have, you can delve deep into the river of Saraswati. Daya taranga nujarah katakshaha. And finally ends in Manasarovar. Avir bhuya dhanaghamahima manase vagadhisha. So if you read Hayagriva Stostram, this one particular shloka, so that is why we have the saying, Orandru thane amayado dharaniyil valvarku vanera pomalavum valvu. So if you study Hayagriva Stotra well, you can master all subject under the sun. And so today, Dr. Swaminathan is going to deliver and talk on Ayurveda. So I quoted the vulnerable points of the body as per Sri Swami Hayagriva, as per Swami Sri Vedanta Deshika. So stimulation of these vulnerable points, these inner pharmacy pathways, signals the body to produce exactly what it needs, including and neurochemicals that heal the body, mind and consciousness. So this deep dimension of marma therapy of Ayurveda has the potential to unfold spiritual healing. So with these few words, I invite Dr.S. Swaminathan to deliver a speech. Again, I welcome one and all. Thank you very much. Thank you.
Hey, video. நான் தெரியலையே. My pranams to Acharyas. I convey my sincere thanks to Sri Kannan Narasimhanji for his wonderful introductory part of my career. My special thanks to Sri Yagarajan sir for inviting me to talk on this platform. My pranams to Sri Saraswati, Srimati Saraswati Murali. My pranams to Dr. T.E.Swaminathan and others who are participating on this platform, and I welcome all of you for this ways and means for a happy life through Ayurveda. If you look into the next slide, please. This is a wonderful introduction to the concept of Ayurveda. I put the health concept in this 2-line sloka to all of you. This sloka, if followed very strictly in one's life, then you look at the sloka, the last line, so aruk, saha aruk. Ruk refers to pain, ruk refers to ill health, aruk refers to disease-free life. How to lead a disease-free life? Ayurveda says, Kale hita mita bhoji krita chankramanaha kramena vamajayaha abhidhrita mutra pudishaveji strishu hitatma so aruk. Now, I will go for the explanation part of this so that we will understand more. The first slide you see there, Kalaha refers to time. It is said in Ayurveda, Kalohi nama Bhagavan, Anadi Nidhanaha, Yadu Upachita Karma Anusari. So, Kala is addressed as Bhagavan, and Ayurveda looks it in 2 different angles. One is called Rutu Vyadhi Apekshaha, that is Rutukalaha. The word Rutukalaha here refers to seasons. Seasons are 6 in number: Hemanta, Shishiraha, Vasanta, Grishma, Varsha, and Sharat Rutuhu. So, this Ritukalaha is very important for a man to decide upon food habits, about ways of leading a life. For example, to give an example, in Varsha Rutuhu, in rainy season, Ayurveda very strongly advises to go for a therapy called Panchakarma. The word Pancha means 5. Karma refers to therapeutics. There are 5 therapeutics in Ayurveda, which one has to go for. What are they? One is called Vamana, vomiting therapy. Another is Virechanam, that is called purgative therapy. You have to clean the intestinal canal by means of purgative drugs. Then another one, enema therapy. Through the anus, the medicine is injected, and in the rectal bag, there is a collection of enormous vayu, gas, which is called apana vayu. When the apana vayu goes out of proportions, people suffer out of constipation problem, and people suffer out of gas, bloating of the abdominal canal. There could be Vishama Agni, that is sometimes the digestion is good, sometimes it is not good, like that. So we have to go for enema therapy. And another one is called Nasyam, nasal medication. 2 drops of Anutailam, there is an oil in Ayurveda. If you instill 2 drops of Anutailam, it drags out all the unwanted phlegm collection from the head. And so, people who suffer out of sinus headache, heaviness of headache, stuffy nose, tongue is coated, and there is a throat phlegm collection, all these are being removed only with the 2 drops of Anutailam. So morning and night after food, if we instill 2 drops, then we don't suffer out of this kapha vikara. And another one therapy, the final one, is called Siravyadham. That is cutting the venal puncture. We make a venal puncture and remove the unwanted, the toxins that are accumulated in the blood. Very surprisingly, there is a point in Ayurveda to focus here regarding venal puncture. For example, only one disease I will take and tell you. When people suffer out of gout, rheumatism, the Anguli Angushta Madhyastam, Kshipram Aksheva Maranam. This is a Marmasthana. In between the Anguli Angushta, there is a point which is called Kshipra Marma. In the Kshipra Marma, we should not do any venal puncture. If you go 2 inches from that spot, you can very clearly see a vein. In my case, it is very clearly seen. If you cut this vein and remove the blood, there are methods to stop the bleeding also. So if you remove that bad blood, you know that gout and rheumatism will get cured. It is a surprising information that I want to pass on to all of you, that Siravyadha, that is venesection therapy, was very popular in India once upon a time. And in this concept, I want to also notify that leech therapy is very famous therapy in Ayurveda. Keeping the leech in a particular part of the body will suck the bad blood, thereby the blood gets purified. Germans have understood the importance of this therapy, and they are popularizing it in their country. Whereas in India, it is not much known. So this is another information regarding Ritu Kalaha. According to the season, we have to modify the food style and then live. For example, when the night is very cold, we are supposed to put a blanket on us and sleep. This will bring us a good comfort so that we lead a healthy life. And for Shauchakaryam, for cleaning of the orifices of the anal tract, the urinary passage, and for the Svedavaha Srotas, for the sweat pores, to clean them, we must use Ushnodakam, warm water, for bathing purpose and for cleaning purposes of the orifices in the winter season. It is beautifully stated. So, Vyaji Apeksha, next one, Vyaji Kala. This is another one. According to the condition of the disease, we have to treat a patient. And in Ayurveda, it is said that treatment is always very, very specific to the dosha, that is Vata, Pitta, and Kapha, which is too much increased, which is moderately increased. We have to find out and treat the case. It is not common. Medicines are not common for all. It is specific to the prakriti, to the constitutional characters of a person in line with the disease that he is suffering from. Example, when a patient suffers out of intestinal gas and peptic ulcer or duodenal ulcer, we prescribe a medicine called Vidaryadi Ghritam, which is very effective in gas and ulcer complaints. So now we ask questions. Out of this Vata and Pitta, which is dominating in your intestinal canal more? Like when the patient complains, I have very severe burning sensation rather than my gas. Then we prescribe Vidaryadi Ghritam along with a pinch of Apraka Bhasma, Shankha Bhasma, and with a little honey in that. So this is not the condition when Vayu dominates over Pitta. There we slightly modify the prescription with less honey, with more ghee. This is a prescription which is beautifully designed in the concepts of Ayurveda. So this is called disease-specific treatment, Yati Kalaha. The next concept is called Jirna Jirnaka Lakshanam. What is Jirna Ajirna Lakshanam? What is Jirnaha? Jirnam. The food what you have consumed in the morning is totally digested, means then we get lakshanas like you see the sloka there, Udgara Shuddhihi. Example, morning, if you have taken about 4 idlis with a little chutney and sambar, when you sit for the lunch time, the smell of the idli, the smell of the chutney and sambar should not come in the belching. If it comes, then it indicates that you have not digested your food totally. There, you have to wait for the complete digestion. Then only you should go for the next meal. This is an advice from Ayurveda in a textbook called Ashtanga Sangraham. In Sutrasthan, it is mentioned. Then, Utsaha. When the breakfast is totally digested and you get Utsaha, enthusiasm, that people pick up the plate and wash it thoroughly and sit with a lot of enthusiasm to take the lunch. This is what is called Utsaha. Next, Vega Utsargo Yadho Ujitaha. Vegaha refers to natural urges. What are the natural urges related to this point is called the fecal matter and the urine. Both this fecal matter and the urine must go utsargo yatho uchitaha. As per the desire, it should get eliminated. The fecal matter and the urine should get completely eliminated from the system with comfort. That is an indication that you are digesting your food wonderfully. Laghuta. The body becomes light. While before taking the aharam, if the body is light, that is called laghuta. Kshut pipasa cha. Kshut refers to the appetite part of it. Pipasa refers to the thirst. All these are the indications that Jirna aharasya lakshanam. That means we are digesting the food in toto. Only then we are fit enough to take the next aharam. Without digesting the previous meal, if you take aharam, then purvasya aharasya Samsrijyamanaha sarvan doshan ashu prakopayati. It is said. So we must always take aharam with the, can you go to the previous slide, please? Please go to the previous slide. Yes. See, there it is mentioned, Ayur Bala Varnan Abhivardhayati. People who thoroughly enjoy these lakshanas, they get a dirgha ayuhu, a long lifespan. Marandhanava vendam yakkaikka. Thiruvalluvar also quotes that Ayur Bala Varnan. Balam, the Sharira Balam, the Manobalam, and the complexion of the body, all these are increased in a person who has a thorough knowledge of this sloka. Next slide, please. See, how to maintain a correct aharam, it is mentioned in this slide. You can see that. Hita Mita Bhoji. I told you that. Kale Hita Mita Bhoji. What is Hita Aharam? What is suitable for me? Only I should take. Not that people take. It is said in Hindi, there is an advertisement. Roj anda khaiye. Roj dudh pijiye. They say, not so. All people cannot take milk. All people cannot take anda. That is egg. It is not possible. Why? Because what is the constitutional character of your intestines? You should plan accordingly and live. That is called Hita Aharam. This is suitable to me. Mamedam Satyam, Mamedam Asatyam. This is good for me. This is bad for me. Once you decide like that, you should stick on to that. Just giving at free of cost in a hotel because he's celebrating his happy birthday, that he calls you and gives you all that items. That people start with what do you call that starters. They start with some soups, and they end up with ice creams. The very next day, they all suffer out of loose motion. What is the reason for that? Because we don't think about our intestinal canal. So, Hita Aharam is what is suitable to you. Example, I just wish to quote here. When people have a lot of phlegm collection in the head, acute sinusitis, running nose, heaviness of head, headache, and the tongue is coated, when the appetite is not good, this is called sinusitis problem. There you are not entitled to take idli, dosha and vada. You know why? Because in idli, dosha and vada, the urad dal is there. Urad dal will certainly increase the kabham. And people take a lot of medicines and they don't care for the ahara. It is not correct. So, in sinusitis, we should not take idli, dosha, vada. What we should take then? We should take only dal. What do you call that? Tur dal, moong dal, black chana, green gram, such items. Rajma, for example. You boil all these items and prepare one yushaha. The word yusha refers to porridge in English. In Tamil, we call it as kanji. Siridanya kanji. And that should be allowed to cool down. After that, when it is cool state, you add a little honey in them and then drink it. As a breakfast, I tell you, you don't need a medicine to cure your sinusitis because your aharam has become correct. When I told this to a patient, you know what he did? He took this kanji and after half an hour, he is enjoying 6 idlis because he cannot control his tongue. He is very much interested in idli, dosha and vada. Then what is the use of me giving a medicine for him? it won't be effective. So, Aharam, Viharam, Aushadam is Ayurveda. Aushadam, Viharam, Aharam is allopathy. That's the only difference. They don't care much about Ahara, but we take a lot of care. And Mita, that's very important word, Mita Bhojanam. Quantity of the food is very important. Matra. See the sloka there. Gurunam ardha sauhityam. Laghunam na atitriptata. You should always consume heavy items. Gurunam. What is a heavy item? For example, maida. People prepare parota. People prepare samosa. Everywhere, even in Puri, they prepare it with maida. Guru Nam. When you take a Guru Aharam, Ardha Sauhityam, you should only fill up with the 50% of your capacity. Stomach. Laghunam na atitriptana. Light foods, steam baked items. You should not take na atitriptata. Don't take up to the fullest satisfaction. That means steam baked items. You take, again, well, I come back to the idli. You take, your capacity of intake of idli is 6. You should take only 4. That becomes na atitriptata. Guru Nam. The word Guru Nam. Heavy item. When you take chapati prepared out of wheat, Ardha Sauhityam, you should take, your capacity of taking chapati is 4. Please take only 2, Acharya says. This is what is called Matra Pramanam. Pramanam, measurement. Matra is quantity. Nirdishtam. People who followed this principle in life, Sukham Yavat Vijiryati, they have no indigestion problem. They digest the food with comfort. Sukham Yavat Vijiryati. The food will get beautifully, nicely digested in the system. So, sticking on to only one taste is very bad for health. Some people take only sweets, very bad. 2 or more taste is okay. Getting accustomed to all the 6 tastes. Swadu Amla Lavanam, Katutikta Kashayaha. These are the 6 tastes. People who take all the 6 tastes in life, they lead a very healthy life. When bitter gourd is given in the house as poriyal, as a side dish, many people don't touch that because of the bitter taste. It is not correct. You must take bitter taste. Why? Because Tikta Rasaha. When you take bitter taste, it removes all the intestinal worms. It has the capacity. Only when you stick on to the sweet taste, then people get a lot of triglycerides in the blood, or cholesterol level will increase and all that. You know that, to quote here an example, you take the Nimba Pushpa, in Tamil, Vepampu, the neem tree is there now, the flower of the neem flower. You prepare one rasam with that and then take that. I tell you that you never succumb to intestinal worms. There is an absolute clarity of the intestinal canal that all the secretions from the inner walls of the intestines in the form of enzymes up to succus entericus, there is a complete formation of enzymes that the food gets easily digested. You know that many people don't like astringent taste. Example, plantain flower. Plantain flower, there is called Vazhaippoo in Tamil. Many people don't like it. But I tell you that it is a wonderful food item because people who take astringent taste, they don't have any corruption of blood at all. The blood is all the time, speck and clean. Kayarasam. Guru, Asya Raktam, Vishodhanaha, purified. The best example for Kashaya Rasa is Haritaki. Haritaki in Terminalia Cebula. In Tamil it is called Kadukka. You powder the Kadukka and take it in the early morning. Don't fry it. Don't make it a nice powder. You remove the seed of the Kadukka and the external layer of the Haritaki. You just fry it with a little ghee and then consume 2 or 3 pieces daily in the morning. I tell you that you will see your great grandson, only then you will die. Even if you want to die also, you won't die. That's a great problem. Huh? How long people can pay the pension to us? That's another problem. No. What I mean to say is that you will live very healthy when you take Haritaki in the morning by frying with a little ghee. This is what is the concept called Mita Bhoji. Next slide, please. Bhojana Kramam. Very, very important. We never stick on to this policy. When the stomach is empty now, we start our food. Adyat Dravyam Guru Snigdham. You start the meal with Guru and Snigdham. What is Guru? Heavy to digest. What is Snigdham? Unctuous. That which is a little greasy. Best example is Payasam. That is why in the marriages you can see they serve the Payasam first. In the right down corner of the plantain leaf. You are supposed to start your meal with the Guru Snigdham Dravyam, a heavy item and a little oily and greasy item. Why it is indicated? Because your Jatara Agni, the Jatara Agni inside is burning now. That you supply a heavy, and a greasy item, that the fire, the gastric fire, can easily digest. Because it is boiling now, it is burning now. So it will invite and digest it with comfort. Now, what is that further thing? Swadu Mandam Stiram Puraha. What is Swadu? Sweet taste. See, Payasam. Mandam. See, all these punch. The word Mandam means very slow to get digested. Mandam means it is very dull in nature. For example, you take banana, red banana, or any Puvan Payam, any banana you take, they have all these properties. Guru Snigdham, Swadu Mandam, Stiram. Stiram means stable. When these properties which are present in a banana or in a payasam, Puraha Adya, Acharya says, you should take it first, so that the Agni which is burning can easily digest. And in the empty lumen, the empty stomach, Vayu dominates. Vayu is more prabalaha. It is prabalaha. When Vayu is dominating in the intestinal area, these properties stand against Vayu. See, Guru, first one. Vayu is Lakhu. See the second property, Snigdham, whereas Vayu is Ruksha, dry. And the third property is Swadu, sweet. Sweet is predominantly rich in Prithvi and Jala Mahabhutam. Kshmambho Agni Kshma. So Prithvi and Jalam are more in sweet, whereas Vayu is Vayu Akasha Dhatubhyam Vayu. It is made of Vayu. It is entirely opposite. Mandam. Mandam, when the food is Mandam, Vayu is opposite to that. It is not Mandam. Stiram, opposite to Stiram is Chalaha, moving. That which is stable is coming inside, that which is Chalam is opposing it. So when these two meet together, Vayu gets pacified. You never suffer out of a gas problem when you stick on to this policy. Guru snigdham swadumandam stiram puraha viparitaskyante. Entirely opposite properties we must take at the end of the meal. Example, takram. You take takram. Takram is buttermilk rice. I see many people don't complete the meal and get out of the place. It is not correct. Buttermilk rice is entirely opposite to these properties. So it will pacify the kapham, which is coming to a domination at the end of the meal. So you pacify Vayu by taking the Guru Snigdha Aharam in the middle, in the beginning, and complete the meal with opposite properties with the Takara Bhojanam. And with a little pickle, whatever cure of diseases when you take this into account. Now, Madhye Amla Lavanotkatam, in the middle of the Bhojanam, we must take Amla Lavana Utkatam. What is Amla? Amla is, for example, tamarind. It is Amla Rasam, sour taste. Lavanam is salt. Where we mix this Amla and Lavanam, it is famously called as Rasam rice. In Tamil Nadu, it is very famous. Rasam Sadam. So we start with the Payasam, enter into Sambar Sadam, and then in the middle, Madhye, Amla Lavanotkatam. Why this is advised by the Acharya? Why? Because this is to keep the Pittam under good control. When the Pittam is not properly initiated, the digestion will get hampered. In order to maintain a proper arrival of Pachaka Pittam in the intestinal canal, Acharya advises to go for this kind of food, Amla Lavanotkatam. So, we don't follow any of these principles. We are all enjoying a lot of food items without looking into any of these concepts. But it was not so in India before 150 years. People were following all this strictly. Next slide, please. Now, people, Moolam Agnistasman Niruchyate, Charaka Chikitsa. People who maintain the Jatara Agni in a good condition, they enjoy all these benefits. You need not go to a hospital at all. What are they? When the Agni is maintained with the previous sloka, what I have told you, if you follow that as a principle, then Jatara Agni is maintained. When the Agni is maintained, Ayur Varno Balam Swastham, long lifespan is there, good complexion of the body is there, Balam, the strength of the fellow, not only the physical, but also the mental strength is also very strong. Swasthyam, what is Swasthyam? Arogya. Utsaham, enthusiasm. Upachayau iti pushti, nourishment of the body. Prabha, lustre. Ojas is something. Ubjati anena iti ojaha. Ojas tejo dhatunam. Shukrantanam param smritam. Ojas is something, an illuminated structure in the body, which takes it will take another big session to discuss about. So let me cut short. Ojaha, Tejaha, that is the Sharira Tejas, which is exhibited in the form of Sapta Dhatus. The complete, you know that there are 13 Agni, fire elements in our body. They are called Sapta Dhatu Agni and the Panja Maha Bhuta Agni. And there is another 13th one that is called Jatara Agni. So all these are Agnayaha. Pranascha Ukta Deha Agni Hetukaha. So they are called, all these are enjoyed with the prana in position. Deha Agni Hetukaha. So, maintenance of Jatara Agni becomes very important for a man to enjoy all these benefits. So, Acharya puts now, Shante Agnau Briyate. When the Jatara Agni, without taking care, you Pashuvat Bhunjate. People who eat like a cow, then the Agni will become Shanta. When it becomes Shantaha, Mriyate Marana. So, in death, what is going out of the body is called Agni. That is why you touch a dead body, it is very chill. Reason, the Agni has become put off. So, Acharya says the importance of this. And also in Bhagavad Gita, Lord Krishna says, Agam Vaishvana Asrata Prana Apana. So it is me who digests all the eatables, lickables, drinkables, and chewables in the form of Vaishvanara. Vaishvanara refers to Jatara Agni. So, Shante Agnau Mriyate. Yukte, when people take the food in a correct proportion, Chiram Jivati, they live for a long time. Anamayaha. Anamayaha, without any disease, they will live for. Rogi Syat Vikrite. People succumb to a lot of diseases when they don't mind the Jatara Agni. So, for all this, Moolam, the root, for all these happenings, Agnistasman, it is Jatara Agni becomes the base for all this, for a long lifespan, for a short lifespan, or with a disease life. All this becomes possible when we don't stick on to the Aharam properly. Rogam, when you properly follow the Aharam, long lifespan. So the next slide, please. See the here. Krita Chankramanaha in the sloka. Kale hitamita bhoji. Krita Chankramanaha. Pada Shatamatram Gatva Ashtanga Sangraha. It is said that you must walk at least 100 feet after Bhojanam, not immediately. Immediately after Bhojanam, you must sit like a king. Rajavat Asitam. You must sit like a king for 5 to 10 minutes. Then you must get up. Not that you should keep on watching Big Boss. People are mad of Big Boss now. Not like that. You must, after Bhojanam, you sit like a king and then you get up and go for a small walk. When you go for a walk in the night, it is very pleasant. But you should not wear any costly jewelry items. Why? Because there could be thieves also around. So don't wear any costly items. You go for a stroll. With whom you should go for? If you are a married person, you go for a walk with your wife. And then you talk about the house matters. This will create a bondage between the husband and wife. Why? Because in many houses, the husband and wife are not at all talking because both are earning members. That they become tired by the evening, they come home, take aharam, and then lie down. You must talk with others, especially with your wife and children. You should have the habit. Sir, I am not married. If you are not married, you can go for a walk with 1 or 2 friends. If that is not possible, you just walk alone by chanting some Veda mantra and think about the Lord and go for a small walk. Now, this will pave the way for easy digestion. Next slide, please. In the next slide, very important. Krita Jankaramanaha Kramena Vamajayaha. You must always turn to the left side and sleep. It is very good for health. Because when you take a left side posture, yojananam shatam layat vama parshvena sambhishetam. People who turn to the left side and sleep, then I just tell you only one or two examples. There are 8 examples. I quote only 2. One is the liver. The liver is in the right side. Please, you know all your visceral parts where they are. Because I remember one incident. One patient came to me and said, by holding his leg, he told me, "Sir, my kidney is paining." I was very much surprised when kidney went to the legs. So, kidney is in the backside. You must know where the human parts are. So, when you turn to the left side, your liver will come up. When it comes up, you know that there is the gallbladder from there, the bile through that, the bile really fall on the food. So when the bile juice falls on the food what you have consumed, the digestion becomes very easy. So when you get up in the morning, you will feel the freshness in you. Not that throughout the night that you should lie down on the left side, because the left side may get into a numb state also. So you can come to the supine posture or the left side posture, but never onto the prone posture. Many people lie down on prone posture. Prone posture means put the chest, the bladder, the intestinal canal, stomach onto the bed and sleep. It is not at all good. You should not compress your visceral parts, because you may get 2 or 3 times urine. When the bladder is compressed, people get to a feeling to pass urine in the night. By that, the sleep will get disturbed. It is not good. One more example, that the food, when it lies on the left side of the stomach, the gastric secretions are from the right side. So the gastric secretions will all fall on the food for easy digestion. One more example, the circulatory system, the blood always circulates in our body from right to left. So when you turn to the left side, the inferior vena cava, which drains the deoxygenated blood, comes to the liver portal vein. From there, it comes into the heart and falls into the chamber. The deoxygenated blood falls into the right atrium, a chamber. From the right atrium, it goes into the right ventricle. From the right ventricle, it goes for the oxygenation purpose to the lungs. And then it comes into the left part of the atrium. From there, it enters into the left ventricle. From the left ventricle, it goes into the aorta, arch of aorta, for the supply of oxygenated blood throughout the body up to the level of capillaries. The heart pumps with great comfort when you turn to the left side and sleep, so that the gushing of the blood to the wall, to the tricuspid, bicuspid, every wall, all that will function wonderfully when you turn to the left side and sleep. This is another example that I want to quote here. The problem became when I told this, a newly married couple, listen to this, when I spoke it in a platform. Then the wife turned to the left side. The husband turned to the left side. They had no children for next 6 months. She was not getting conceived. Why? No, she was very adamant. No, 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 no. That fellow told me that we should turn to the left side. This is not correct. This is not a way of life. Then they both came and told me, "Sir, what is this? My wife is not at all getting conceived. Then I have to take an education for her. This is not life." So Turn to the left. It is good. Next slide, please. Avitrita Mutra Purishavegi. This is another important sloka. You should not forcibly control your urges. Like Vegan Nadharayet, Vata Wind Mutra, Shava Trutshudham, Nidrakasa Sramashwasa, Jrimbha. Asrus Chardiredasam, natural artists that we should never, when we get the elimination of that, it is said that in Ayurveda, Vegito Anya Karyaha Nasya Ajitva Sadhyamamayam. When you have a natural urgent, attend to the nature call first, then you go for the next work. To quote an example, you see, when people control the fecal matter, the fellow wants to go for a defecation. He is traveling in a bus, or he is traveling in a crowded train, or he is much worried to go to a toilet in a flight, that he controls the fecal matter which is coming out. Shakritaha, the fecal matter. When voluntarily controlled, it will produce Pindikottveshtaha. The Pindika Udveshtaha, that is the calf muscle now. It is called gastrocnemius muscle. The calf muscle will get tightened, which will produce enormous pain. That is called Pindikottveshtaha. Surprisingly, Acharya quotes Pratishayaha, running nose. See, a person controlling the fecal matter suffers out of running nose. What is the connection between the nose and the fecal matter? But Acharya says, Pratishayaha, Shirorujaha, headache. There will be severe headache. That is acceptable. Why? Because when the fecal matter is voluntarily controlled, the gas which comes up, instead of going out, it goes up. And you know that there is a diaphragm here. The diaphragm, it will go up. There is an enormous pressure created in the thoracic basket, which will produce the headache. That is okay. Urdhavayu, the vayu which is supposed to go down, it will come up. That is called reverse peristalsis. Parikartaha. The word parikartaha means scissors. As if cutting the intestinal canal with a scissors, that kind of a feeling will be there. That is called parikartaha. Hritayasya uparodhanam. There is a block in the heart area which will lead to a lot of problems, heart-related ailments. Another example, Acharya wants to quote here. This is, of course, this is a very big chapter. So only I am quoting a few examples. When we voluntarily control the urinary urge, when people want to urinate, and if it is controlled because of a bus travel, anga bhangaha, there is a cracking pain will happen all over the body. Ashwari, there is a chance of getting calculus, kidney stones. Basti refers to urinary bladder. Medra refers to the penis. Vankshana refers to the pelvic angle. Vedanaha, pain. Pain in all these areas will happen, where you have to go to a urologist for treatment. So, Atrata adakkinalum, Mutrata adakkaga, in Tamil we say. When we control that, these are the complications. Next slide, please. Strishu jitatma, a good control of sexual life is also important, as semen is considered as the finest essence of the body. Kayasya tejaha paramamhi shukra ahara sarad abhisara bhutam Jitatmana with the control of senses. Tat paridakshaniyam, tato vapuhu. By that, the body is protected. Santatir apyudara, the santati, the progeny, have a good uh, progeny. People who are born out of a good semen. A child which is born out of a good semen will live very healthy, not only physically, but also mentally. So Acharya says that husband and wife should never have a sex life on Chaturthi, Ashtami, Amavasya, Paurnami, and Pitrupindadana. These are all contraindicated days for sex life because sex education is important in the India, not only in India, globally. Why? Because children with the autism disorder are being born in more in number now. I have patients in United States of America. They contact me. We have a video and I suggest medicine. When I look at it, I feel very. You know what is the reason? Because people do not know when to have, when not to have sex. So you may ask me why all these days are contraindicated. I'm sorry. It is called Apta Vakya. When Acharyas quote, there could be reasons, but they say, and you know that a lady who gets the menstrual cycle, for example, today, she gets the menstrual cycle. From today, you count the 11th day. On the 11th day, if the husband and wife will have a coitus, sexual intercourse, they will definitely have a mentally weak child. Ekadashina, it is quoted. On the 11th day, no sex. Why? Because the child will be born with autism disorder. We want children in India with a good physique and join in military and protect the country from various enemies. You know that India is in need of more military people. Next slide, please. Next slide. See, this is an important concept that I want to tell you. Humans have 4 kind of Agni, Jadhara Agni. The one is called Vishama Agni. What is Vishama Agni? Inconsistent. Sometimes the appetite is good, sometimes the appetite is not good. This is not at all good for health. This is not at all good for health. Why? Because when Vayu dominates in the body, then erratic digestion will take place. When sometimes the Agni is good, sometimes it is not good, you get confused. When to go for food. Vayu is dominating in you, you will feel the stomach bloated. You will get the belchy and the gas is going out through the anus. In that condition, there is a good tablet in Ayurveda which is called Vayu Gutika. Vayu Gutika is a good tablet. It is only mustard size. You take 2 pills of that and then crush it in the teeth and then drink a little jeera boiled warm water or Omam boiled warm water. Anything is okay. You take that, I tell you that your Vishama Agni will become Sama Agni. Okay. Coming to the Tikshna Agni. People who have more Pittam, why Pittam is increasing in the body? People who take lot of mirch masala, people who take Amla, Lavana, Katurasa, Karam, Puli, Uppu. If these 3 things are taken too much in the form of Belpuri, Pani Puri, or in the form of what you call Dahi Puri, if you go to mall in Chennai, I see many people all the time, 3 times meal is only all this dahi puri, pani puri, samosa, and people take a lot of rich masala items. You know what will happen? Your agni will become tikshna. It will start burning. That how much more and more you consume, the food will get digested within no time. That is called bhasmaka rogam. Whatever you take will become bhasma. This is very dangerous because people cannot control their agni. So what to do now? How to make it samaha? You should not take amla, lavana and katu. Instead, you go for the other three tastes, Madhura, Tikta and Kashaya. Then your Pitta will come down. Madhura Ahara, for example, you take Rasagulla, or you take one Barbi, coconut Barbi, or you take Tirumala Laddu. Yes, your Pitta will come down. Not only because of the Laddu, because of the Anugraham of the Swami. Pitta will come down. Then you have to eliminate the pittam. It is not that you pacify the pittam, that is enough. No. We should periodically eliminate the pittam by means of virachanam. How to do virachanam? Very simple. You take this kismis, dried grapes, and you take a rose bud. These two items, you soak it in hot water in the night time. Next day morning, you crush these two items in the water, filter, and then drink the water. You will have a purging of pittam. 2 or 3 times you will pass motion. In that, all the unwanted pittam will come out. Then you may feel, okay, now that I have eliminated all pittam, let me go and enjoy one bel puri and pani puri. No. You can spoil your stomach occasionally, because I too take bel puri and pani puri, but not all the time. When I feel my agni is mandam, then I take a little bel puri and pani puri to make it all right. That technique we should learn from the Shastras. Then, coming to the Manda Agni. What is Manda Agni? Very dull. Jataragni. I have seen one of my students sitting in the mess hall, finding it difficult to eat one idli. I remember her name also by name Manjusha, one girl from Kerala. She was eating this. Even to eat one idli, she was finding it tough. I asked her, Nama, what is your problem? Sir, I am unable to take this idli. Why? Because I feel more Manda Agni. When you feel Manda Agni, it is better you go for Ashtachurnam. Ashta, 8. There are 8 ingredients in this powder. You take half teaspoon or maximum 5 grams. You mix it with the hot rice. Add a little ghee in that, and then you passengify and you eat the first bolus. Then it is called Ashtachurnam. Tirkataka Majamoda Saindhavam Chirakadve Samadharana Dhritanam Ashtamo Hindu Bhagaha. They are adding Kayam, Perungayam, Asafoetida in this powder and make a wonderful medicine. There is a company called Kottakkal, Arya Vaidyashala. You purchase this Ashtachurnam and keep it ready in your house. When the children, they don't take the aharam properly, you prescribe this, the child will start eating when you are sleeping. When you are sleeping, the child will slowly go into the kitchen and search for kadalamitai and all that. That is the beauty of this powder. And when we take the Ashtachurnam, or there is a lehyam called Jiraka Bilvadi lehyam, you lick and eat morning in empty stomach. Throughout the day, your Agni is protected. There is an item called Dashamola Arishtam, which is also meant for Manda Agni. It will keep your Agni in a good condition. Already I told you, when Agni is in good condition, that we will live for a long time. Right. This is due to Kapha. So, when the Kapha dominates in the stomach, you know what Ayurveda says? Eliminate that rascal. You eliminate the kapha by means of vamanam. Vamanam is vomiting therapy, emetic therapy. We give. We regularly do that and remove the kapham from the stomach. By that, the agni becomes all right. So, what we should enjoy is the fourth one, samagni. Samagni, hridosha samaha. When vata pitta and kapha, what is the vayu? It is called samana vayu. Samano agni samipastaha. Koshte charati sarvataha. Annam ghrinnadi pachati vivechayati munchati. It is quoted. Samana vayu and apana vayu are there in the intestinal canal. They should be kept in good condition. Then the next one is Pachaka Pittam, which should be kept in a good condition. And there is a kapha called Kledaka kapha, in that which brings moisture to the food item what we have consumed. And there is a kapham in the tongue, which is called Bodhakam. If that Bodhaka kapham, Kledaka kapham are good, then the food, however tough you consume, will be made into a dough state and easy for digestion. So we must all get sama agni for dirgha ayuh. Coming to the next point, next slide, please. I refer to a wonderful anjana. This is called anjana, collyrium. There is a medicine called Yalanir Koyambu. There is a medicine called Netramritam. You instill only one drop of this in the eyes at night bedtime. For the first 2 or 3 minutes, you will have a burning sensation in the eyes. After the 3rd minute, you are in Kulu Manali. Your eyes will become so cool, and the dust which is accumulated in the eyes by going outside will all get drained out by this method. Not only that, your vision will also become good by instilling only one drop at night. Next slide, please. There is a medicine called Anutailam. I already quoted in the beginning of my talk. Anutailam is a small bottle. You take only 2 drops, maximum 4 drops. You put it inside the nose. What you have put in the eyes, the dirt which is getting drained out can also get drained out through the nose also. When it comes into the nose, you are putting Anutailam. By that, the Anutailam will suck all the dust and will take it to the throat. And when you spit out, all the dirt will come out. By this, this is called head cleaning method. Those days, a radio was cleaned when they put a particular tape to clean the head cleaner. Head cleaner is best in Ayurveda with this kind of a treatment. And when you put 2 or 4 drops of Anutailam regularly in your life, there is no time for all that. You know that when people laugh once, they put Anutailam. At the end of the meal, people put 2 drops. At the end of Snanam, 2 drops. At the time of retiring to bed, 2 drops. Like that. There are 15 timings are there for this nasal medication. When you put that, what are the benefits you see? Ghana unnada prasannatpak skandhagriva asya vakshasaha nirdridhendriyasta palita bhaveyur nasya shilinaha. And nirvali palidastanta bhaveyur nasya shilinaha is also there. Ghana means strong. Unnada is elevated. What is that? Skandhavada. The shoulder will become very strong. See, you are putting 2 drops here, but the benefit is here. You know that there is a disease called periarthritis, where people cannot rotate the shoulder joint. They feel pain. That pain will never be there when you put 2 drops of this here inside the nose. I told one lady, you put 2 drops in the nose. After 7 days, she came and said, apply, no reply, sir. Then I asked, what you did? As you said, I put 2 drops in the nose. You show me how you put it. She was putting it on the nose. And then putting it and then doing like this. Like this. I had not asked like that. You should put it inside the nose. Then only you'll get the effect. So, ghana, strong, unnada, elevated, skandha bhagaha, shoulder. Prasannatwak, the face illumines. The face, you need not apply any snow cream. You need not apply Pond's face powder. Your face will all the time look bright and brilliant. When you are in Tanjavur, you are seen at Vallam Shastra University. That much of brightness will come onto your face. And Griva, this neck, there is a cervical spine here. That cervical spine will become very strong. You know that this is called cervical spondylitis, where people cannot move their neck freely. They get pain. You look up, down, they cannot do. They cannot rotate their head also. There is severe pain. They put a collar and then they live. All these can be removed by nasal medication. Asya, mouths. The mouth becomes speck and clean that you don't get a bad smell at all. Vakshasaha, the chest. There is a pectoralis major muscle. That muscle will become very strong that somebody gives you a punch. His fingers will break. Nothing will happen to you. It is something like a kavacham. What Karna was wearing now. That kind of a kavacham will develop by doing this. I am really surprised. By putting 2 drops in the nose, that this much of benefits are there. Dridhendriyaha, all the sensory and motor organs, including the manas, will become dridhaha, stable. Palita, the word palitaha iti, gray hair. Even if you become 60 or 80 also, you don't get gray hair at all. That is the beauty of this wonderful thing. Bhaveyur nasya shilinaha. So next slide, please. Mouth gargling is very important. It is called oil pulling. There is an oil called Arimedadi Tailam, which is available in Kotakal Ari Vaidashala. You take 1 cup, that is a bottle is exhibited there. You take full cup of this oil and then put it in your mouth and then start shaking it. You shake it for 5 to 8 minutes and then spit it out. You know what are the benefits? Manya. Manya refers to, there are 2 nerves on the back side of the neck. Manya, Shiraha, head. Karna, ear. Mukha, this mouth. Akshi, eyes. Roga. The diseases pertaining to all these areas will get totally removed by oral oil pulling therapy. Not only that, prasekaha, dog salivation. When people get excessive salivation, that will get controlled. You know that there are glands. There are 2 glands here, 1 gland here, which gives out the saliva. That will get controlled. Kandha refers to the throat. Amayaha, disease. Throat disorders like diphtheria, tonsillitis, uveitis, all that will get cured. Vaktra soshaha. Vaktra refers to the mouth. Soshaha means dryness. The mouth dryness will totally get removed. Hrillasaha, palpitation of the heart will also get controlled. Tandra, especially stupor, that is called laziness. Laziness will get removed by putting oil in the mouth and shaking it. See, I'm really surprised. How can a fellow live without laziness is possible with this therapy? Aruchi, loss of taste. All the taste buds in the tongue will open by this oil pulling. Pinasastya, running nose, will get cured. Sadhyaha, Visheshat Kabalagrahena. All these are possible. Definitely possible when you do oil pulling. When to do oil pulling? Maybe for gents after shaving, you can do that. Ladies at the time of retiring to bed, you can do that. It is good for your health. And I tell you that by all these methods, when you turn 90 years, you will look like 25 years. And all for this is for the gents, I mean, the young girls will approach you for want of marrying you. Sir, can I marry you? You look handsome. They'll tell you. Why? Because you are using all these medicines. You never become old. You always look young. And when I said this in Reserve Bank of India, one lady asked me, you are pointing to the gents and telling, what about my case? I told her, madam, you use this regularly. You will never become old. That young boys will approach you for marriage purpose. My dear, you look so beautiful. Can I marry you? And what is your age now? 75. At the age of 75, people are having such a demand in the marriage market. Great. Next slide, please. Anjanotkleshitam nasyaihi. By putting drops in the eyes, the utkleshitam, the medicine will liquefy the unwanted dirt and bring it to the nose. From nasya karma, it will come into the mouth. By oral washing therapy with the oil, kabalair navaneritam. By that, all the dirts from the head will get clear. Dhumena kabalot klishtam. By dhumapanam, smoking therapy is indicated in Ayurveda, but not with the scissors cut or with all scissors. What is it? Something is the gold flake filter is being sold in the market. I am not referring to such cigarettes. There are wonderful Ayurvedic methods. For example, you take Datturam. Dattura is Dattura metal. Tamil Umattai. Umattai ele. You take the leaf of Dattura metal. Dattura is a leaf. You just put it in the, when it is wet, when it is fresh, you roll it. You roll it. And then you dry it in the sun, in the sunlight. After that, you burn the tip and then take the smoke inside. You take this smoke inside, I tell you, you will not suffer out of dandruff problem. There won't be any lice in the head. Irum penum irukave irukadu. There won't be any problem related to the head hair. So, dhumena kabalotklishtam kramat vata kabham jayeta. By this method, you can conquer vata and kabham. Next slide, please. This is a treatment which is mentioned in Ayurveda in the Dinacharya, Dinacharya, daily regimen. People are doing this. Khadiraha, Acacia catachu. In Tamil, it is called Karungali Kattai. And one more information, people who have skin problem, like itching, black patches, all that, you take this medicine regularly. Khadiraha Kushtaghnanam. It is mentioned. When you take a little of this, boil it in water. There is a calculation. All that I can tell you only when you attend to me in a personal note. So you drink this water, then that the skin problem will get eliminated. Kshiri vrikshaha. That is called Chatukshiri. Chatukshiram means Nalpamara Pattai. Alambattai, Arasambattai, Attipattai, Ittipattai. There are 4 milk exudating ficus trees. They are called Kshiri Vrikshaha, Arimetaha, Babul in Hindi, In Tamil, it is called Velam Pattai. So this is called bubble toothpaste is also coming now. So Arimathus, all these are taken and boiled in water and used as Kabalagraha. You put in the mouth and slowly shake it. By this, Arochaka, loss of taste, Asya Vairasya, the infection, the inflammation, the bacteria, all related to the mouth will all get eliminated. The bad smell from the mouth will get relieved. Prasedajita, excess salivation will get totally controlled. Next slide, please. I have only 5 minutes left to tell you some important points. This is also a forgotten method in India now. It was in practice those days. You take an oil called Vacha Lashunadi Tailam. Vacha refers to Acorus calamus. In Tamil, it is called Vasambu, Vasambu Katta. Lashuna refers to garlic. Wonderful medicine, garlic. This oil is prepared out of all these, etc. And when this is applied warm, when it is instilled warm in the ear, then people never succumb to Hanu, Manya, Shirah, Karna Shulaghanam, Karna Puranam. The word Hanu refers to the mandible joint. There won't be any mandible pain at all. You can consume 14 chapatis just like that. You don't get pain at all in this area. Manya, again this, it is called two nerves, the back side of the neck. It is called torticollis disease. Shiraha, head. Karna Shulaghanam, pain. There is a headache and the pain in the ear will all get removed by this wonderful method. Next slide, please. You apply Durvadi Tailam. Durva refers to Arhampullu in Tamil. You apply this Tailam on the face, then the face, you will not have any black dots. There won't be any black dots. There won't be any disease related to. For example, if the dark circles around the eyes will also get relieved by this method. Next slide, please. You use Asana Vilvadi Tailam. You know why all this I am telling you now? You will not get affected by coronavirus when we use all these medicines. If you go up to the up slides, from there if you follow all these principles, we will not get coronavirus attack at all. Sakeshyaha, when you use Asana Vilvadi Tailam on the head, it is good for the hair. It is Murdhani Kapalendriya Tarpanaha. It will strengthen the head, the skull, the sensory organs which are located in the head. In fact, all the sensory organs are located in the head only. You get all the sensory organs. They're all becoming strong when you use Asana Vilvadi Tailam. Next slide, please. Tambula Sevanam, again to prevent coronavirus. You see the wonderful point of this, how Tambula Sevanam is taken. Yeah. So when you look into the sloka, you take only 2 leaves of that with a little lime and with a little kadiram. Then it is Bhaktarasya Abharanam. It is not only that Tambulasya Sakhe Trayo Dashagunaha Swargepite Durlabhaha. You don't get these properties even in Swargadoka. That is why in Tanjavur belt, many people take Tambula Sevana. I am from Tanjavur belt only. I am from a place called Manjakudi, very close to Kumbakonam. Kodavasal, Manjakudi, you go straight, Thiruvarur will come. So in my village, I have seen all the people enjoy Tambula Sevana to prevent not only the Kaphavikaram, but they do not know that they don't get affected by coronavirus with Tambula Sevana. So the last slide, please. Last slide. I want to thank you all for this wonderful patient hearing. See, all these slides are there, which is a very big one. This normally I put all these slides in Reserve Bank of India for the general managers and for the retiring staff. They all enjoy for a 2-hour session and understand what Ayurveda is. So all of you, please stay home, stay safe, and be healthy. I thank you all for this uh, wonderful platform to get for me to talk on Ayurveda in front of this august audience. Thank you. Thank you. Namaste. Namaste. Sarve bhavantu sukhinah. Sarve santu niramayaha. Sarve bhadrani pashyantu. Ma kaschat dukkha bhavet. Namaste. Namaste.
अतः अस्माभिः एवम् अवगतं पथ्ये सति गदार्थस्य किम् औषधनिषेवणैः पथ्ये असति गदार्थस्य किम् औषधनिषेवणैः आयुः कामयमानेन धर्मार्थ सुखसाधनम् आयुर्वेदोपदेशेषु विधेयः परमादरः इति भवति वाग्भटाचार्याणां वचनम्। तदनुगुणं स्वास्थ्य संरक्षणार्थं तत्र भवद्भिः आचार्यैः उपदिष्टानि मधुमन्ति वचांसि श्रोतॄणां मनांसि आह्लादकराणि सन्ति। अस्मत् प्रार्थना मुररीकृत्य श्रुतिजाल मार्गणे अस्मिन् कार्यक्रमे भागमोढ्वा आयुर्वेदस्य प्रामुख्यम् अस्माभिः दैनन्दिन जीवने अनुसरणीयान् मुख्य अंशान् इति अनेकान् विषयान् सरलबोधैः वचनैः प्रभाषणं विहितवद्भ्यः आचार्येभ्यः अस्माकं हार्दिकान् धन्यवादान् समर्पयामः। एतादृशं विशिष्टम् अमूल्यं च सदवकाशं कल्पितवद्भ्यः अस्माकं शास्त्र मानित विश्वविद्यालयस्य कुलाधिपतिभ्यः कुलपतिभ्यः संकल्प विकसन संकाय प्रमुखेभ्यः डीन प्लान एंड डेवलपमेंट कुलसचिवेभ्यः अस्मत् प्राच्य विद्या संशोधन विभागस्य अध्यक्षेभ्यः सहाचार्येभ्यः अंतर्जाल संकोष्ठी श्रृंखलामिमां वेबिनार सेमिनार समुचित रीत्या चालयितुं साहाय्यं विहितवद्भ्यः सूचना प्रौद्योगिकीय अध्यक्षेभ्यः IT विंग तत्कार्यकर्तृभ्यः अन्ये च ये साक्षात् परंपरया वा कार्यमिदं सम्पादयितुं समुपकृताः तेभ्यः सर्वेभ्योऽपि सानन्दं सप्रश्रयं नतिततीः धन्यवादान् च समर्पयामः। विशिष्य अस्मत् छात्र संकुलेभ्यः विश्वस्य नाना प्रदेशात् इमं कार्यक्रमम् अनुभूयमानेभ्यः दर्शक मंडलेभ्यश्च हार्दिकान् साधुवादान् कृतज्ञताश्च समर्पयामः। धन्यवादाः सर्वेभ्योऽपि नमो नमः।
Sir, thank you very much. It was a very wonderful and enjoyable one. Everyone has given positive comments. Every one of us has been enjoying. There have been a lot of questions, but a few questions, if time permits, you can enlighten us, sir. One question is from Mrs. Sushila Kannan. She is asking whether can we do mouth gargling with sesame oil, gingerly oil?
Yes, ma'am. Good question. In Vedokta Kala, if you go 200 years, 300 years back in India, people were using only gingerly oil for mouth gargling. So it is good, but this is a medicated oil that what I have suggested. So this is also good. And she can certainly go for gingerly oil.
Thank you, sir.
Yes.
Thank you. And another question is from one Madam Gayatri. From which age Kadika is advisable to children?
So, from the age of 7.
Thank
from
you.
The age of 7.
7. Yeah. And another Mr. Sudarshanam Srinivacharya, he has asked a lot of questions. I'll tell one or two. Why inner seeds are removed from Podalangai?
Podalangai.
Podalangai.
Why? Because the inner part of the seed is poisonous. It is poisonous. And so it is removed. If you ask me the reason for that, I cannot tell you chemically what it is. But it is poisonous. Like in Kadka, the Kadkaikku ahatte nanju, injikku puratte nanju. It is stated. So the inner part of Kadka is also dangerous. Adupole, Podalangai inside is.
Yes, sir. And why ghee is banned by allopathy for people with blood pressure?
It is not that it is banned, like they say you don't take ghee, but they forget to say that you should take the ghee in a melted form. See, நெய்ய உருக்கணும், தண்ணிய குறுக்கணும், தயிர பெருக்கணும். This is a policy that we don't adopt in our life. That is why, see, I take a lot of ghee. With my hot rice, I add a lot of ghee, in fact, 4 or 5 teaspoons daily, and take go ghritam, pashu nahi. And whenever I check my cholesterol, it is very normal. In fact, it is very, very normal. The reason it is not so, the cholesterol is a concept which is developed of late, but certainly now they are going back. They say that it is not banned. Ghee is advisable by the American doctors now. It is accepted.
Thank you very much, sir. Very valuable input. Thank you so much. Thanks to Dr. Kannan and Sastra University. Thank you, sir.
Thank you. Namaste. Namaste.